Hi, my name is Dr. Reed Williams. I'm a medical doctor licensed here in the state of Texas, and I look forward to telling you a little about Dr. Miller's practice, MeRT, and some other functionalities, and what my family and friends' experience has been. Let me also say, although I'm a physician, I'm not affiliated with Dr. Miller's clinic. I am a colleague in medicine and have gotten to know him, and mostly through friends and family who have come to the clinic for various treatments. So I've been very impressed with the team, with the technology, with the improvement, and hopefully you'll get to hear about some of that today. So Dr. Spencer Miller is the founder of the Brain Treatment Center, which started here in Dallas, and now Dr. Miller has clinics in various parts of the state and in other states across the United States, and they're reaching out and impacting the lives of families with traumatic brain injury, families with major depression, with all sorts of neuropsychiatric issues, and they're having a tremendous impact, and so much of it is being done without the side effects of major medication, and that is a big deal for many, many families. So I'd like to share a personal story. Our family has utilized the services of Dr. Miller and the Brain Treatment Center. And I have 5 children without naming any of the children. I have one child in particular who was having great struggles. These were academic struggles. These were struggles that had sent us across to a scurry of different physicians trying to find answers for help, mostly that were showing up in the academic world. And so after meeting with doctor after doctor after doctor and finally ending up at a specialty school that really focuses on just being able to help, we found that we were still struggling. And in particular, we had some learning differences and some challenges that the teachers were saying, well, this will be a problem or a challenge for the rest of their life. And around that time, I started spending time with Dr. Miller, understanding what he was doing with MeRT and with other modalities. And so we decided to go ahead and try. So before we did, I allowed myself to go ahead and try and found that there were some improvements for myself just on a personal basis. And so this one child of ours, I think, was around the age of 9 years old and was having tremendous difficulty being able to finish any tests on time at this learning different school. And after just a short series of treatments, we were surprised, the teacher was surprised, even Dr. Miller was surprised that the teacher was calling, asking us, what have you done? What has changed? This child has just finished all the work that all of the other kids do, and she can normally only do maybe 5% of the work in the standard amount of time. And they just finished all the work. So we knew we were heading in the right direction. So we've continued with MeRT therapy, and over a series of treatments, we found that there was tremendous benefit at home, benefit at school, benefit with the learning differences. And so it has made a dramatic impact in our life, and it's something that we firmly believe in. We've been sharing this with other friends, with other colleagues, and we will continue to tell the story. So what is MeRT? I had never heard of it, and it is a magnetic stimulation that goes into the brain, and it very lightly stimulates portions of the brain at a particular frequency in order to get that portion of the brain in sync with the other parts of the brain. And so after a treatment of, it may last 10 or 15 minutes of stimulating a particular area, all of a sudden the treatment is over, come back a few days later, do it again, continue to repeat the process, and it builds on itself, and it allows for the brain to begin to get all portions of the brain firing in sync with one another, which sometimes is a tremendous part of the cause of issues like major depression and learning differences and sleep disorders and various other things. So I have gone through the treatment myself, and I have a friend who is a psychiatrist here in town, and he has been in to undergo the treatments on many occasions for himself just because it makes him feel so much better. So there are a variety of reasons. Dr. Miller can outline all of it. It's certainly worth a discussion. I would encourage you, if you're looking for something that's a little bit different, you may have tried other approaches that doesn't have any negative side effects that I have seen, then reach out, talk to Dr. Miller. Dr. Miller is very approachable. His team is very friendly. The office environment, as you can see behind me, is very nice. And they're just trying to make everyone feel comfortable, from the patients to the family members and whoever's attending. So they do a wonderful job here, just getting to know you and trying to specifically help with whatever it is. So if you've heard about MeRT, you may have heard that that is an in-office treatment. You do have to come into the office to get treatment. They're not allowing for a home device, and this is the high-end quality, top-of-the-line equipment. It's very expensive, and it requires a technician that really knows what they're doing, physician to be able to read the EEGs and understand the baselines and set the direction for where they're going. But there are also home opportunities that Dr. Miller may be able to talk to you about that can be used as follow-up to the MeRT treatments here in the office. Oh, there's another treatment I wanted to talk about, which is neurofeedback. And neurofeedback is a technique where they have a patient hooked up to some monitors that are just little sensors that are on top of the head. And as you are learning to focus the brain on different areas, then you get different feedback. And so it's a very powerful modality. They have a technician who's an absolute expert at neurofeedback that will be able to look at the EEGs, which is kind of the baseline study that's done, and then from there be able to help dial in feedback that trains you how to train your own brain on how to improve and overcome various issues. And so we have used that within our family on an extensive basis, and we have a number of friends that are also utilizing neurofeedback. Some of you may have children that may benefit from MeRT therapy. I was in that position, and it's a bit of a scary question to wonder, well, what's happening to my child's brain? Is this benefiting my child's brain? Is there any downside to the therapy? I'm happy to report that we have had only positive experience with the therapy, and so even Dr. Miller's own family, his own children, have utilized the treatment. So there has been extensive evaluation, and I'm absolutely a believer that the therapy in the right setting with the right team for certain, not every need in the world, but for certain needs, it has a tremendous impact and is completely safe. So feedback is great with Dr. Miller, both in person, sitting down with the team and talking with you and your family members about what the treatment entails and what the follow-up looks like. They're very approachable, very easy, and very communicative. They do a lot of it by online video, where you can just FaceTime or utilize a special platform where he can answer and see you and talk and ask questions, get questions answered for you. So the team is very approachable, and they want to have as much feedback as they possibly can so that you can understand exactly what's happening. They'll map everything out, show where things have been on various wavelengths within the brain and where things are going, and actually show all the progress. So it's a very informative process. So we have a big family. We have multiple family members who have gone through MeRT treatment, and it's been astonishing to see the improvement over time with the MeRT treatment from session to session to session. So it's not always something that happens immediately, but it is something that very quickly Dr. Miller can tell you if you're a likely candidate for benefit or not. So they do a great job of just not wasting your time, but utilizing your resources, your time as best possible to head you in the right direction using the best techniques. So some of you are parents of kids and you're asking the question, is there a therapy out there that can help? Dr. Miller has a variety of therapies. Some of them may be able to help. He's going to shoot straight. I found them to be completely honest and of integrity, and they're going to tell us if something is likely to help or not, so that it's not wasting your time. And so I've been very appreciative of that. If I was a mom or a dad, I would feel very comfortable, and I have felt very comfortable as a parent, coming in and asking questions and trusting this team with my child. So